We are here in Studio A, and we're talking about kids going back to school, right? A lot of them are, and one of the worst things that they can come home with is lice.
That's right, and it's getting even worse right now because there's a superbug form of it, if you will, super lice out there. It's even harder to treat, and it's resistant to a lot of those shampoos that you find over the counter. So we're taking action for you to get to the bottom of this, let you know how to treat it. Let's bring in our expert here. This is Dr. Fred Shulski with MVP Kids Care. So, Dr. Fred, thank you so much for being with us. So, is this super lice strain, is this something you're seeing a lot in your practice?
We're starting to see it a little bit. It's been found in about 25 states around the United States, so it is becoming a worry.
Wow.
Yeah.
So it is something that's out there. We quite haven't seen it in Arizona yet, but we know it's going to be coming.
Okay, so what are the big differences, just to let people know about, you know, the normal lice that they've heard about, you know, their whole lives growing up, and then this super lice?
Well, the normal lice that we typically grew up with and know about are taken care of with the over-the-counter type products that you would find at a local drugstore. Okay, so some of these things,
so
like Rid and Mix,
those brand names we're all familiar with.
Correct. They've been around for years and years, and that's been the standard of care for these things.
Okay.
Because these have been overused or misused, like other antibiotics have, we're starting to see the super strain of lice.
Okay. How can you tell the difference between the two, or is it just one of them dies off with the over-the-counter stuff and the other one sticks around?
That's pretty much what it is. Is if you try the over-the-counter and it doesn't die off, you've got the super strain.
Okay, so then what can we do if they find that, you know, this is something they're dealing with?
Well, the biggest thing to do is make sure that you actually have a lice infestation, okay? Just because you got a message from school saying that, oh, we've seen lice, that doesn't mean that your kid is infested. So one of the most important things is to call your provider and have them take a look to see if they can find any live louse or if they can find any of the nits, which are the eggs that hang around the ears and the back of the neck. So that would be the first step, to make sure you're actually dealing with a lice infestation.
Okay, I wanted to talk about these brushes too, because you said something that was really important about them. Explain that to our viewers.
Right. One of the parts of the treatment is just not using the shampoos and lotions, but it's actually after you rinse out the lotion or shampoo, is to go through with these combs and comb out the hair. And the problem is, if you have a young lady who has lots of hair, like my two daughters, that is very curly, it's a very laborious process, and you just have to spend a good 30 minutes doing this. And really, it's a hard thing to do as a parent because, you know, we're busy most of the time, especially at night when we're getting kids ready for bed. But this is an extremely important part to get rid of the nits, the eggs, most importantly.
Well, Dr. Fred, unfortunately, we're all out of time, but I want to thank you so much for taking action with us and letting us know about this. And for more information, of course, you can just visit MVP Kids Care online and check them out and see any of their service providers.